Hello and welcome to Critical Political Thinking. Today is May 6th, 2020, and today's video we will cover the current status of America and how America plans to reopen, and what steps are necessary before those actions can take place. My name is Camasso, and welcome to Critical Political Thinking. Hello and welcome to Critical Political Thinking. Today is May 6, 2020. In today's video, we are going to be covering a great deal of issues. But first, we are primarily going to start with how is America going to reopen. We're currently at 1,230,000 confirmed cases. That's a substantial number. There are 328 million Americans. 328 million Americans, of which 1,230,000 have been infected with the virus confirmed. That is tested. Now we need to remember that they are saying between 2 to 3 times the amount of people that were tested actually had the virus, but had such mild symptoms that they either weren't tested or just never even realized that they had the virus. So that could mean the counts are upwards of 2.4 million and 3.6 million. So the numbers are actually between 2.4 and 3.6 million Americans that have actually contracted the coronavirus, of which we do have a confirmed number of 71,294 have passed away. Now what we do need to understand is they're giving death percentages, but those percentages are going to vary greatly, at least 2 to 3 times, by the simple fact that more people have had the virus than they have tested. They're basing those percentages on the tested. But if 2 to 3 times the amount of people had the virus and they're not testing those people, or they haven't tested those people as of yet with the antibody testing, there's no way to actually determine how many Americans have had the test, or rather have had the virus. And where that comes into play is basically how we plan to reopen America. Currently, they're reopening America based on viral outbreak and based on what scenarios the healthcare systems are capable of handling. There are certain criteria, and we're going to go over all the criteria that need to go into place, and in our opinion, what systems should be in place before we can completely reopen or even begin the reopening process. We do need to understand that some states have begun this process and have taken the liberty of giving the liberty back to the Americans, to give the choice back to the people. And while this can be positive, and hopefully in their case it is, I can see it as an irresponsible action for the simple fact that we have already taken these extreme mitigation efforts. We've already literally put so many businesses in a predicament that they more than likely may not get out of. However, those actions have already been taken. The death toll has already risen. We're at 74,000 Americans that have not made it through this virus. That's a lot. It's a lot of people. Granted, last year from the flu, around the same amount passed away. But we're not done yet. These numbers are still substantially high. And from the looks of things, most Americans haven't been infected with this virus yet. And from the antibody testing, like they have already mentioned, there's no viral antibodies that we can really produce yet, and they're not going to have this type of a vaccine for at least another year. So what we need to understand is, no, we're not ready to reopen wholly. There are a lot of situations and environments that we can't put ourselves in at this point. A lot of our bodies are capable of handling this virus. I don't want to put the fear of God in people. We're more than likely capable of surviving the virus if you contract it. However, some of your loved ones, some of your friends, some of your neighbors are not in a position where they are as well off as you. So while you may be capable of making these decisions, and while you may be able to handle mitigation efforts for yourself, we also need to take into account other Americans at this point. We've already derailed the train. Now it's a matter of, can we rebuild the tracks long and far enough to get us back to the station? Let's start with the steps that need to be taken before we can reopen wholly. First, we have to understand where the virus is and where the hot points are, or the locations of the higher viral content. Meaning, for instance, in our community, there's a town called Hazleton. That town has literally switched the numbers for our entire county because of the outbreak, due to the close proximity of residents, due to the inability to have understood the English direction that was initially given. There was just a lot of barriers that were in place that prevented this town from not necessarily receiving the health care it needed, but understanding the situation they were in to get to that health care. So there are so many communities and so many areas that we have to understand where the virus is, how it's tracking, and we have to put together a valid tracing system that can move between communities. So it's important for states to have the power of reopening because, yes, this is something that needs to be handled at a smaller level. The federal government can't say, okay, you open, you open, you open. Wrong. We need to understand that our county government, in my opinion, would be the essential determining factor. They are the most positioned to understand the community the best. They have the ability to communicate with the healthcare professionals within their community and understand our current situation with PPE, hospital beds, ventilators. All of those things are so important, and we have to have in place before we're capable of reopening. Because if we do go back and this virus does climb and the death toll starts to rise at substantial numbers and the infection rate begins to grow again, we need to know how we're able to handle it, and that the fear and the anxiety that we initially had, that we weren't going to have enough ventilators, we weren't going to have enough bed space, that can't happen again. We need to establish that the protocols are in place, that the community is safe regardless of viral infection. And we need to understand that without this tracking system, there is absolutely no way to determine where these outbreaks begin or where they're coming from or how they establish. So the first and most important and vital step is to form a tracking or tracing system. Once you get a tracking or tracing system in place and you're able to identify which areas haven't been as affected, then you need to establish, okay, what businesses are capable of reopening and in which pattern should we reopen these businesses. Obviously, you're not going to start with businesses that aren't capable of social distancing. You're not going to start with businesses that aren't capable of providing either one-on-one care or... See, it's hard to say one-on-one care. So they're trying to make rules such as, one person for at least retail space. But then you look at the big box stores and you don't have one employee per one customer. So there are so many states and there are so many areas that are giving such conflicting data that's what's aggravating Americans. The fact that they're allowing some people to choose and others to have no say whatsoever and to force into closing. So while I understood from the get-go, I was concerned. I didn't want my business closed. I didn't think they had the right to close it. But the further I understood and grasped the situation, the more I understood the severity and the need for these protocols. And I think that's what really needs to happen for everyone. They all need to have that epiphany, that realization that this is real. This is affecting us. And if we don't take the necessary steps, we'll never it's so much different for so small communities. They don't get what's going on in New York City. They don't get what's going on in Chicago, Louisiana. They don't understand the situation at hand and how the fear is real that they're going to run out. No, it's not like, a war scene where there's millions of people getting wheeled in every 2 seconds. It's not like that. But the people that are getting wheeled in are so severe that the care that's needed and the respirator and the level of PPE and separation that's required really limits the ability for some of these smaller hospitals to handle that workload. And that's why it's key to establish at a county level, because the state can't really properly monitor these levels at a speed that would benefit anyone, at least at this point. There's no system in place yet. So what they really need to do, and the federal government needs to step in and say, okay, here's what we need to do. While the states are doing a great job, they're trying to reopen, we need to set it down to the county level. The state should not have grasp on the entire situation. Counties need to have a very, very big say in what's going on because, like I said, they're in the best position to succeed for us. Basically, they have all the business information already. They have all of your, through your various, whatever documentation you're going to need for your county to operate your business, whatever permits you've required, all of that information is at the county level for the most part. Also, that county level can establish, based on need, a task force. This task force can be implemented for two reasons. Number one, to keep this situation under hand once the Pennsylvania Health no longer has the daily things, once Governor Cuomo is no longer giving daily interviews. We have to have a COVID team per county set in place. And this team is, number one, responsible for sharing and documenting information that's pertinent to that county, as well as establishing a task force to go out and ensure that these companies are following said protocols. We also need to set a central goal of said protocols. And there's a great company that's already jumped right on the ball, and they are really covering this well, and that's covidsafe.us. This is a website that has already been established. They're already developed and trademarked and have the ball rolling on a wonderful coronavirus training program. This training program is key. It is going to give you, your staff, and management different levels of training, but the training that's necessary for the role that you play in your business or your practice or whatever you're planning on opening and when you plan to open it. But this would be a universal certification. This way your customers can enter with confidence, knowing that they have the proper training and the proper know-how and the understanding of the virus and how to protect you from it. So, stepping back, we need to have tracking and tracing in place. We need to have training in place. And lastly, we need to have public information and a plan based on business need. There are a lot of businesses, while I would love to see open, they're just not ready to be opened. There are a lot of hands-on businesses where your job is literally touching and manipulating things and passing that on to others. Those jobs we can't do that. Casinos, theaters, where there's constantly people in and out, unless they're really, really going to step up their game, which by all means, if you're a business owner and you're capable of passing a ServSafe or a COVID safe certification, and this certification covers all the necessary needs, and your county task force can come into your business. And that's why it's necessary at a county level, because they're capable of visiting these locations fast enough that it's something that could be beneficial. So if you're a county administrator and you're watching this, please pass this information along. This is how we will succeed as a country. We need to develop first a central organized system that establishes the education, because there is so much misinformation out there. It's not even funny. Depending on which search engine you use is going to determine what you know about the coronavirus, and that's not right. While each state has a great Department of Health website and the federal government has a great Department of Health website, we need a COVID site. We need a COVID organization, and that organization can be a department. And then that department can transfer to a viral infections department. And that viral infections and outbreaks department can constantly be there for reasons just like this, so there's no more $3 trillion going out the window at a first stimulus package. And I'm not saying out the window, it is going to benefit America, but had we done this a little bit different, and had we had these protocols already in place, we wouldn't be rushing to put them together last minute. And states wouldn't be putting people in jeopardy for opening prematurely. And I'm not saying prematurely in a sense that they're not ready. I'm saying prematurely in the fact that the proper training hasn't been implemented and a universal system of training hasn't been implemented. And it needs to be before this can successfully work. All we're doing is opening and testing the waters. right now, anyone that's opening is testing the waters with their fingers crossed, hoping for the best. But that's not how we need to handle this situation. There are so many businesses right now that are just dying. And I can tell you, the PPP and the EIDL was a failure from the get-go. I'll tell you, that was the worst thing that the SBA has ever released, and it shouldn't have been part of the stimulus package. They should have just focused on the PPP, and then once they realized all the businesses that fall through the cracks, the sole props, the independent contractors, all the things that really don't have enough employees, that this covered them. Those are the loans that need to go into place now. The government needs to start focusing on the small businesses that are not able to reopen. If you're capable of reopening, you open. You follow your CDC guidelines, your Department of Health guidelines. You follow those to the T. Not for you, but for everyone. You follow them because that's what we need to do as Americans. And through that, things will fall into place, but unless there is a central county-wide system that is capable of understanding the current situation for those people within that community, this essentially can't work. You can't do it from a state level, because when you open this and you open that and you don't have the community behind that decision, and that community that decided once they were ready, because they're the ones that developed a plan, you're only going to have failure. And you're going to have people crossing borders, going here, going there to do what they should be able to do in their own community, because you're not enabling it, because the county doesn't have the control or the ability that it needs. Take, for example, a small consignment shop. They have the ability to either A, list their items online. Sure, it's a lot of work, but if you want to have a business right now, you got to do a little bit of work. So if you have that online, you have a pickup, you have online ordering. Say they want to come in and try something on. That makes it more difficult. If you're willing to wash those clothes, if the person doesn't buy them, if you're willing to take certain actions, then yes, you should be able to open. But there needs to be a protocol in place to establish whether or not you are ready to open. Because you can't just determine that on your own, because you haven't been given all the facts, because there is no central location for the facts. It's all coming back to that central location. We're going to be able to reopen America. Most of our businesses may or may not be able to make it back, but they're going to try. I'm certainly going to try. Certain businesses just can't open yet. But what the federal government needs to do is therefore step in and support those businesses. It is essential that those businesses be allowed to survive. Especially if they're good tax-paying Americans that have had their business up to this point, they've done everything right, then they deserve to continue. If you force them to close and tell them they can't reopen based on their situation, that's not their fault. That's something that no one should be at fault for, and that is what our country is for, and that is what the government is for, to fix these problems. That's not the majority of businesses. That's some businesses. Other businesses, such as, let's say, haircutting. I would love to have a haircut. Clearly, it's getting longer and longer every video that you see. But what I can tell you is that personally, if I can't cut my own hair, then, oh well. At this point, it's not worth me risking the life of the haircut person. But if that haircut person decides to open, and they feel that they are capable of providing me with safe care, then it should be my choice to go to that haircut place. Personally, I won't go. That's my decision. That's my choice. And that's what America's all about. But at the same time, as long as you are practicing those social distancing guidelines and you think that you are capable of doing what the CDC states, then that's fine. But the CDC is the one that needs to step in and say to these counties, these are the guidelines, these are the businesses, this is what we have, this is where we need to go. And now it's your responsibility to lay those down, and it's your responsibility to enforce. Because at the end of the day, that's putting the counties back in play. That's giving the counties profit through fines. That's giving the county the ability to get back into place and to run their community properly. Guys, we got to do this the right way. We can't just reopen the door. As much as I want to say it should be the business owner's right to just do it, while it should be their right to open, only if they're capable of following set guidelines. And those guidelines need to be set. They have to be. And tracking has to be done. And in all honesty, antibody testing needs to be done. You need to understand whether you've had this virus or you haven't had the virus. And if you haven't had the virus, then you need to understand the need to continuously test. And even if you had the virus, you need to continuously test, because from what we understand, you can catch it again. So either way, you're going to be a carrier throughout the whole process that this virus is here. And that's why it's essential not to reopen businesses until they're capable of handling the certain protocol to keep that business safe. Furniture stores should be allowed to open. Mattress stores, as long as they're willing to cover the mattresses. So much as even a theater should be technically allowed to open if they're spacing out to a certain percentage and they're covering the seats in plastic. Why is that not a possibility? There's no different from that than if you're going to, let's say, a bus to get to work, or walking through Walmart, you're still touching your feet on the ground. You're sitting on something plastic. You use the restroom in public. What I'm saying is there are ways to do this, America. But until we have a safe protocol in place, it's never going to work. It's not. There's no possible way. So no, America, we're not ready to reopen. And the only reason we're not ready to be open is because our government hasn't set it up yet. Unemployment will hold us until the end of July. It will. I mean, regardless of what's going to happen, we need over the next 2 months to focus on reopening. And we need to, if we own a business, get in that business. Start at the front door and make your way around that business. Because it's going to take you about a month to protect that business and to get that business ready to reopen for this virus protection plan that they're going to put in play. So yes, you need this next month. You need to be in that store. And while you're in that store, if you have the ability to sell something, sell it online. Mercury, offer up. Use these services. They're available to you. Facebook Marketplace. Do something. I'm making videos. I own a DJ company. I mean, I can't DJ a wedding until at least we get into the yellow phase. And then I'm going to be doing weddings with Zoom. And I'm doing everything in my power to provide a service for everyone through my company, and to save weddings and to save parties and so on and so forth. But I know for a fact that until certain facilities are ready to handle that crowd, I mean, there are large facilities and we could spread a wedding out. I don't think they should certainly number it to 25, groups of 25 or more. If you've got a room of 10,000 square feet, why? Why? If you're capable of spreading these people out in a large room, let them have their celebration. Let them keep separate. Let them dance at each table with each family, as long as they're practicing social distancing. But this needs to be done at a business-to-business level, county-wide, not state, and not a whole state at a time. There are so many different environments within a state that you can't just do that. You can't. It just doesn't make any sense. Where's your brain, America? We're better than this. We're smarter than this. This virus has killed 71,000 Americans. That's a lot. The flu has killed just about as many last year. I'm not debating that. While the virus may not seem as serious to some people because they haven't caught it, or it's not as serious to certain health, but it is. It's real, it's here, and there's nothing you can do about that. Arguing isn't going to change it. But what will change it is working towards a solution. My name's Corey Camasso. I really appreciate you watching our podcast here at Critical Political Thinking. This video is dedicated to getting America to understand the need before we're capable of reopening. We're capable of reopening, but we need to do it right. We get one chance at this, America. Let's do it the correct way. Thanks for watching.